Welcome to the deep dive. Today we're going to be looking at stomach cancer with this in-depth article from health.com. You really gave us quite the reading assignment, huh?
Yeah, it's a lot.
Covers everything from those subtle early signs to the latest treatments and even lifestyle changes that might lower your risk. Ready to get started?
Yeah, absolutely. Let's jump in.
Okay, so the article starts off by saying how stomach cancer develops in the lining of the stomach. And even though researchers don't have a clear-cut answer for the exact cause, there are several risk factors.
Right.
What really jumped out at me were the things people can actually control, like diet and lifestyle choices. That's pretty empowering, wouldn't you say?
Absolutely. Yeah. It really kind of emphasizes that we're not just passive bystanders.
Right.
We can take charge of our health. And for instance, the article points out that smoking and excessive alcohol consumption are major risk factors.
Right, those are things that we can directly address.
Exactly.
And then there's diet. I'm curious, what kind of dietary choices does the article highlight as being potentially risky?
Well, it specifically mentions a diet high in processed foods, red meat, and salty, preserved foods.
Oh, okay.
And then on the flip side, it says that a diet rich in fruits, vegetables, and whole grains is associated with a lower risk. So,
So it seems like making conscious food choices can really make a difference. Now, the article also delves into different types of stomach cancer, with adenocarcinoma being the most common.
right.
But even within that category, there are two subtypes,
Yeah.
intestinal and diffuse. Why is that distinction important from a medical standpoint?
Well, it turns out that this difference can actually impact treatment options and outcomes.
Really?
And intestinal adenocarcinoma tends to respond better to certain therapies
Oh, wow.
because the cancer cells have specific mutations that make them more susceptible.
That's really interesting. So knowing the specific subtype can guide treatment decisions and potentially lead to better outcomes.
Exactly.
Now, onto those early symptoms. The article makes it clear that they can be pretty sneaky and easily missed.
Well,
What are some of those subtle signs that people should be aware of?
we're talking about things like indigestion, feeling bloated, and a sense of fullness even after eating a small amount.
Okay.
These are all symptoms that many people might brush off as just an upset stomach.
Right.
But if they persist, it's really crucial to get them checked out.
Right, because those seemingly minor issues could be signaling something more serious.
Exactly.
I think a lot of people might hesitate to go to the doctor for something like indigestion, but this article is a good reminder that it's always better to err on the side of caution.
I completely agree. Yeah,
Early detection is key when it comes to stomach cancer.
absolutely.
The earlier it's caught, the better the chances of successful treatment.
Exactly.
Speaking of early detection, the article brings up a fascinating connection between stomach cancer and infection with H. pylori bacteria. Can you tell us more about that?
Well, H. pylori is a bacteria that can live in the lining of the stomach, and it can trigger changes that lead to inflammation.
Okay.
And over time, increase the risk of cancer. But here's the good news. H. pylori infections can be effectively treated with antibiotics.
So, in a way, addressing this bacterial infection could be a preventative measure for stomach cancer.
Exactly. It's a prime example of how taking care of seemingly unrelated health issues can have a ripple effect on your overall well-being.
I think that's a really important takeaway for our listeners. Now, how is stomach cancer typically diagnosed? The article mentions a whole range of tests, from blood tests to endoscopy to imaging scans. It can feel a bit overwhelming.
It can, but each test plays a unique role in helping doctors piece together the puzzle. A blood test, for example, can reveal if someone has anemia, which might indicate bleeding in the stomach.
Okay, that makes sense. What about an endoscopy? I've heard that term before, but I'm not entirely sure what it entails.
So an endoscopy involves inserting a thin, flexible tube with a camera attached to it down the throat and into the stomach.
Okay.
It allows doctors to visually inspect the stomach lining for any abnormalities, like ulcers or tumors. They can also take a biopsy during the procedure, which means taking a small tissue sample to examine under a microscope.
So it's like getting an up-close and personal look at what's happening inside the stomach.
Yeah.
And a biopsy can confirm if those abnormalities are cancerous.
Precisely. It's a crucial step in making a definitive diagnosis.
The article also lists a bunch of imaging scans, CT scans, endoscopic ultrasounds, PT scans, MRIs, chest x-rays. What's the purpose of all these different scans?
These imaging techniques provide a more detailed picture of the stomach and surrounding organs.
Okay.
They can help determine the size and location of a tumor, whether it has spread to nearby lymph nodes or other organs, and help doctors stage the cancer, which essentially means classifying its severity.
So it's like gathering intel to plan the best course of action. It's quite a complex process.
It is.
It really is.
Yeah.
So before we were talking about all those tests involved in diagnosing stomach cancer. Now, what happens if someone does receive a diagnosis? What are their options in terms of treatment?
Well, the good news is that there have been significant advances in treatment in recent years.
Yep.
The choice of treatment really depends on the stage of the cancer, the overall health of the patient, and their personal preferences.
Right.
But the article dives into some of the most common approaches, like surgery, chemotherapy, and radiation therapy.
Okay, let's break those down a bit. Surgery seems like a pretty straightforward option, especially if the cancer is caught early.
Yeah.
What's the goal of surgery for stomach cancer?
The primary goal is to remove the tumor
Okay.
and a margin of healthy tissue around it to ensure they get all the cancerous cells.
Okay.
And in some cases, surgeons might also remove nearby lymph nodes to check if the cancer has spread.
So it's like a safety net, making
Yeah.
sure they've removed as much of the cancer as possible.
Yeah.
Now, what about chemotherapy? When would that come into play?
So chemotherapy uses powerful drugs to kill cancer cells.
Right.
And it can be used in a few different ways.
Okay.
Sometimes it's given before surgery to try and shrink the tumor, making it easier to remove.
Okay.
Other times it's given after surgery to mop up any remaining cancer cells that might be lurking around. And in some cases, it's used as the main treatment if surgery isn't an option.
So chemotherapy can be a key player at various stages of treatment.
Yeah.
Now, radiation therapy was also mentioned in the article. How does that work?
Radiation therapy uses high-energy rays, like X-rays,
Okay.
to damage and destroy cancer cells.
Okay.
It can be used in a similar way to chemotherapy before surgery to shrink the tumor, after surgery to kill any remaining cancer cells, or sometimes as the primary treatment if surgery isn't feasible.
It sounds like both chemotherapy and radiation therapy can be pretty tough on the body. Are there any side effects people should be aware of?
Yes, unfortunately, both chemotherapy and radiation therapy can come with side effects.
Yeah.
Some common ones include nausea, fatigue, hair loss, and changes in appetite.
Right.
But the good news is that there are ways to manage these side effects.
Okay.
And not everyone experiences them to the same degree.
So it's important to have open communication with your doctor and care team to make sure you're getting the support you need.
Absolutely. Open communication is key.
Now, in addition to these more traditional approaches, the article also mentions newer treatment options like targeted therapy and immunotherapy.
Right.
I've heard about those, but could you give us a quick rundown of what they entail and how they're different from chemo or radiation?
Of course. Targeted therapy is like a sniper rifle, zeroing in on specific vulnerabilities within cancer cells.
Okay.
It uses drugs that block the growth and spread of cancer by interfering with specific molecules involved in the growth, progression, and spread of cancer.
So it's a more precise approach than chemo or radiation.
Exactly.
I got it.
And then there's immunotherapy, which is fascinating because it harnesses the power of the body's own immune system to fight cancer.
Okay.
These therapies work by stimulating the immune system's natural ability to fight the disease.
So it's like giving your immune system a boost to target those road cancer cells more effectively.
That's a great way to put it. And these newer therapies are really showing a lot of promise in the fight against various types of cancer, including stomach cancer.
That's encouraging to hear. Now let's talk about life after treatment. The article mentioned something called dumping syndrome, which can occur after stomach surgery.
Right.
What exactly is dumping syndrome?
Dumping syndrome is a group of symptoms that can happen when food moves too quickly from the stomach into the small intestine.
Okay.
It's more common in people who've had part or all of their stomach removed.
So why does that happen? What causes the food to move so quickly?
Well, normally the stomach acts like a reservoir,
Hmm.
slowly releasing food into the small intestine.
Okay.
But after surgery, that process can be disrupted,
But-
and food might bypass the stomach altogether or move through it too rapidly.
I see. And what are some of the symptoms of dumping syndrome?
The symptoms can vary, but often include nausea, diarrhea, cramping, sweating, lightheadedness, and a rapid heartbeat. It can be pretty uncomfortable, but the good news is that it's usually manageable through dietary changes.
So would working with a dietitian be helpful in this situation?
Absolutely.
Okay.
A dietitian can provide personalized guidance on what to eat and how to eat to minimize those dumping syndrome symptoms.
That makes sense. It's amazing how interconnected our digestive systems are with our overall health. Now, the article also highlights the importance of follow-up care after treatment for stomach cancer.
Right.
What does that typically involve?
Follow-up care is all about monitoring your recovery, catching any signs of recurrence early, and managing any long-term effects of the cancer or its treatment.
So what kind of things would happen during a follow-up appointment?
It usually involves regular checkups with your doctor,
Okay.
which might include physical exams, blood tests,
Mm,
and imaging scans like the ones we discussed earlier.
right.
The frequency of these checkups depends on the individual case and the stage of the cancer.
So it's about staying vigilant and proactive even after treatment has ended.
Mhm.
And I imagine maintaining a healthy lifestyle is also crucial during this phase, right?
Absolutely. A healthy diet and regular exercise can go a long way in supporting your body's healing process and reducing the risk of recurrence.
Right.
The article emphasizes the importance of nourishing your body with nutrient-rich foods and staying physically active.
It's interesting how healthy habits play a role in both prevention and recovery. The article also mentions some specific lifestyle changes that can lower the risk of developing stomach cancer in the first place.
Yeah.
What are some of those key takeaways for our listeners?
Well, we've already touched on a few, like avoiding smoking
Right.
and limiting alcohol intake.
Right.
But the article also emphasizes the importance of maintaining a healthy weight,
Yeah.
eating a balanced diet rich in fruits, vegetables, and whole grains, and limiting processed foods, red and processed meats, and salty or pickled foods.
So it's about making those everyday choices that can have a big impact on our long-term health. We've covered a lot of ground in this deep dive, from risk factors and symptoms to diagnosis, treatment, and even life after treatment for stomach cancer.
We have.
Is there anything else that stands out to you from the article that our listeners should keep in mind?
Yeah, one thing that really struck me was the emphasis on early detection.
Mm-hmm.
It's so crucial to pay attention to your body
Right.
and any unusual symptoms, even those that seem minor.
Yeah,
Don't hesitate to talk to your doctor if something feels off.
I completely agree. We often put off those doctor's visits, but it's always better to err on the side of caution.
Exactly. And remember, there's a lot you can do to lower your risk in the first place.
Right.
Those healthy habits we talked about, like not smoking, moderating alcohol, and eating a balanced diet, those can make a real difference.
It's empowering to know we have some control over our health destiny, right?
Absolutely. And
Yeah.
the link between H. pylori infection and stomach cancer is a perfect example of that. It's a reminder to take those seemingly unrelated health issues seriously.
Yeah.
Getting tested and treated for H. pylori could be a simple step with potentially significant benefits.
It's like taking care of the little things can sometimes prevent bigger problems down the line.
Precisely.
Yeah.
Prevention is always better than cure.
Well said.
Right.
We've covered a lot of ground today, from those subtle early signs to the latest treatment options and lifestyle factors that may reduce your risk.
We have. We've also highlighted the importance of early detection.
Yes.
Seeking medical attention if you experience any persistent symptoms, and maintaining open communication with your healthcare team throughout the entire journey.
This deep dive has been incredibly informative.
It has.
But remember, it's just a starting point.
Yeah.
If you have any concerns or questions, please reach out to your healthcare provider for personalized advice.
And as always, stay curious and keep learning.
Until next time, take care.